Dialysis technicians play a critical role in healthcare by assisting patients with kidney failure and other renal conditions. They operate and maintain dialysis machines, monitor patient health during treatments, and ensure strict adherence to hygiene and safety protocols. The role requires both technical expertise and compassionate patient care, as patients often undergo regular and lengthy treatments. Employers look for candidates who combine clinical knowledge, technical skills, and excellent communication abilities. During interviews, demonstrating experience with dialysis procedures, understanding of patient care, and attention to detail can make a significant impact. This video presents common dialysis technician interview questions, sample answers, and practical tips to help candidates prepare effectively. Understanding the role of a dialysis technician. Dialysis technicians are responsible for setting up and operating dialysis equipment, monitoring patients for complications, and ensuring all treatments comply with established protocols. They work closely with nephrologists, nurses, and other healthcare professionals to deliver safe and effective care. Additionally, dialysis technicians maintain equipment, manage supplies, and educate patients about the dialysis process. Employers evaluate candidates on technical proficiency, patient management, attention to detail, and adherence to safety standards. Demonstrating empathy, reliability, and the ability to handle stressful situations during interviews can set candidates apart from others. Question 1. Can you describe your experience as a dialysis technician? Here's how you can answer. I have worked in both hospital and clinic settings, assisting patients undergoing hemodialysis and peritoneal dialysis. My responsibilities included setting up dialysis machines, monitoring vital signs during treatments, and ensuring proper sterilization and maintenance of equipment. I also assisted in patient education, helping them understand dietary and lifestyle considerations to support their treatment. Tip: highlight practical experience, types of dialysis performed, and patient interactions. Specific examples of handling critical cases or emergencies strengthen your response. Question 2. How do you prepare a dialysis machine before treatment? Here's how you can answer. I begin by inspecting the machine and tubing for any damage or malfunction. I then follow the manufacturer's protocol for priming the machine with dialysate and testing its functionality. I ensure that all alarms are functioning and that the equipment is sanitized according to infection control guidelines. This preparation guarantees patient safety and treatment effectiveness. Tip: emphasize attention to detail and adherence to safety and hygiene protocols. Employers value candidates who take preparation seriously. Question 3. How do you monitor patients during dialysis? Here's how you can answer. I continuously monitor vital signs such as blood pressure, heart rate, and oxygen saturation. I observe for any signs of discomfort, hypotension, or complications such as cramping, dizziness, or nausea. If any abnormality occurs, I notify the supervising nurse or physician immediately and take appropriate measures to stabilize the patient. Tip: highlight vigilance, clinical awareness, and quick decision-making. Patient safety is the top priority. Question 4. How do you handle emergencies during dialysis? Here's how you can answer. In case of an emergency, I remain calm and follow established protocols. For instance, if a patient experiences sudden hypotension, I stop the dialysis process, assess the patient, and provide immediate care while alerting the nurse or physician. I also ensure proper documentation and communicate with the healthcare team to manage the situation efficiently. Tip: emphasize the ability to stay composed under pressure, follow protocols, and act promptly. Employers value candidates with strong problem-solving and crisis management skills. Question 5. How do you prevent infections in a dialysis unit? Here's how you can answer. I strictly follow infection control protocols, including hand hygiene, proper use of gloves and protective equipment, and sterilization of machines and surfaces. I ensure that dialyzers, bloodlines, and needles are used according to guidelines and disposed of properly. Regular monitoring and adherence to hygiene standards minimize the risk of infections for patients and staff. Tip: demonstrate knowledge of infection control and dedication to patient safety. Highlighting certifications in infection control can strengthen your answer. Question 6. How do you educate patients about dialysis care at home? Here's how you can answer. I provide patients with guidance on diet, fluid restrictions, and signs of potential complications. I explain how to manage vascular access, maintain hygiene, and monitor their condition between treatments. I also encourage patients to ask questions and provide written instructions or resources to reinforce their understanding. Tip: highlight communication skills, patience, and commitment to patient empowerment. Employers appreciate technicians who support patient self-care. Question 7. How do you ensure proper documentation during dialysis treatments? Here's how you can answer. I maintain accurate records of treatment start and end times, vital signs, machine settings, and any patient reactions. Proper documentation is essential for monitoring patient progress, communicating with the healthcare team, and maintaining compliance with regulatory standards. Tip: emphasize accuracy, attention to detail, and familiarity with healthcare documentation protocols. Employers value organized and reliable record keeping. Question 8. How do you handle multiple patients in a busy dialysis unit? Here's how you can answer. I prioritize tasks based on patient needs and treatment schedules. I coordinate with nurses and other technicians to ensure smooth workflow and minimize wait times. By staying organized, I can monitor each patient closely while maintaining high standards of care. Tip: highlight time management, multitasking, and teamwork. Efficiency without compromising patient safety is crucial. Question 9. How do you manage a patient who is anxious or uncomfortable during dialysis? Here's how you can answer. I approach anxious patients with empathy, explaining each step of the procedure and answering their questions. I maintain a calm demeanor, provide reassurance, and adjust the environment to increase comfort, such as offering blankets or adjusting seating. Building trust and providing emotional support helps patients relax and cooperate. Tip: emphasize interpersonal skills, empathy, and patient-centered care. Employers value technicians who can support patients both physically and emotionally. Question 10. Why should we hire you as a dialysis technician? Here's how you can answer. You should hire me because I bring a combination of technical expertise, patient care skills, and commitment to safety. I have experience managing dialysis treatments, monitoring patient health, and maintaining equipment to the highest standards. My dedication to patient well-being, ability to handle emergencies, and teamwork skills ensure that I contribute positively to the healthcare team. Tip: summarize your strengths: clinical knowledge, patient focus, reliability, and teamwork. Make your answer concise and persuasive. Final thoughts. Dialysis technician interviews assess both technical competence and patient care abilities. Demonstrating proficiency in dialysis procedures, infection control, patient education, and emergency management is essential. By highlighting your practical experience, commitment to safety, and strong communication skills, you can show employers that you are a well-prepared and capable dialysis technician. Combining clinical expertise with empathy and professionalism will increase your chances of securing the position and positively impacting patient outcomes.